Hello. The topic of my teaching scenario was ultrasound guided IV peripheral access placement. The purpose of this teaching session is to educate SICU registered nurses on the placement of ultrasound guided IV peripheral access. The lecture portion of this session is to be presented on a clinical skills day in the SICU. During this time, learners will be given the opportunity to discuss prior experiences through interactive group discussion, listen to lecture, and ask questions before taking this lecture material to the bedside. At the bedside, learners will be given the opportunity to demonstrate their skills on actual patients under the supervision of an expert ultrasound guided IV registered nurse. So, what's the reason for this teaching scenario? This session is designed to improve experienced surgical critical care nurses' ultrasound guided IV skill sets and enhance their confidence. Unfortunately, nurses sometimes lack the confidence and motivation to improve their skills due to inexperience or fear of failure. Within the surgical critical care setting, obtaining quality IV access can be quite challenging as patients are often obese, edematous, hypovolemic, or require recurring venous access attempts. Adrian et al. 2022. Patients in which access is warranted are at high risk for delayed intervention due to lack of IV access. Therefore, using ultrasound guided IV catheters increases success when obtaining access because this technique provides a clear visualization of the vessel on a portable monitor, contrary to standard IV access placement, cited in McKinney et al. 2022. The ultrasound guided IV skill set has become more desirable as it provides quicker access, fewer attempts in puncture sites, greater odds of success, and higher patient satisfaction, thus enhancing patient outcomes. What is our mission? My goal in this teaching session is to create a psychologically safe and inclusive learning environment in which learners feel confident in implementing a new skill set into clinical practice. This aligned almost identically with Penn's mission. Their mission is to advance knowledge and improve health through research, patient care, and education of trainees in an inclusive culture that embraces diversity, fosters innovation, stimulates critical thinking, supports lifelong learning, and sustains the legacy of excellence. Some of the strengths and weaknesses. All of this is great, but how can I do better? I find the strengths of this course are in the didactic portion, as it is clearly organized and presents ample information to bolster the registered nurse's knowledge of the intended skill set. I feel that in offering this course to nurses with experience in standard IV placement, it was a great opportunity to enhance their skill set. The nurse will get real life hands on experience with the patient and has an opportunity to practice those skills with the guidance of an expert registered nurse. I find that my weaknesses come in creating and aligning high level learning objectives with my lesson plans. This was a tricky task, and mastering this takes practice, time, and experience, as I've learned throughout this curriculum. Working in reverse order was a way that helped the overall creation, in that I was able to fine tune my objectives based on teaching strategies I used, teaching tools and assessments, and teaching tools and assessment and evaluation identification. One other weakness that I identified was the potential level of increased cognitive load that the learners experienced when demonstrating their skills on live patients, which often left room for failed attempts. So, how can I do better, and what are some ways to improve? One way in which I plan to potentially decrease learner, or I could plan to potentially decrease learner cognitive load, would maybe be to offer an option to participate in some type of pre-demonstration zone 2, zone 3 simulation training. When introducing a skill set such high level as this through simulations, educators are given the opportunity to guide a nurse or learner through a process, ensuring their attentiveness and comprehension, ultimately increasing the confidence before engaging in a clinical setting. As a nurse, I never really had this experience, as we were just kind of thrown into it and said, "Okay, well, you're going to take the machine. This is how it works, and go figure it out." And I feel that maybe in offering some type of simulation pre patient engagement would create a psychologically safe space that will allow a learner to engage and express ideas without fear of negative consequences. Henriksen et al. 2017. So I wanted to take the time to thank you for listening to my presentation, and I am happy to be at the tail end of our curriculum.